Welcome to the 3D Heart Project series of videos. I'm Jared Sheridan, a pediatric cardiology fellow at the Stollery Children's Hospital in Edmonton. Today, I'm going to go through the anatomy of the second stage of what is called single ventricle palliation. When we say palliation, we mean that this surgery cannot repair the single ventricle, but instead allows blood flow to where it needs to go through a different path. This surgery is called the Bidirectional Cavalpulmonary Anastomosis, but is more commonly called the Glenn procedure. This surgery is typically the second surgery done for patients who are born with one functioning pumping chamber, the ventricle, instead of two pumping chambers. This surgery typically takes place around 4 to 6 months of age. One of the common reasons to need to do this surgery is for a condition called hypoplastic left heart syndrome, for patients who have already had a Norwood procedure. If you want to learn more about the first surgery for single ventricles, the Norwood, then click this link to 3dheartproject.com, where you can get more information about the typical or normal heart, hypoplastic left heart syndrome, and the Norwood procedure. We also have a glossary of definitions for this video available on the website. Let's get started.
The models will be shown to you as if you are looking at the heart inside the body of someone in front of you. Each 3D model of the heart can be made to show either the muscle of the heart or the blood that is contained within the chambers of the heart. Today, we are going to be using a model that shows the blood inside the chambers of the heart. This is called a blood pool model. This type of model is used to show how large the inside heart chambers are, which gives us a clear idea of how big each part of the heart is. We can also see the blood in the important blood vessels that connect to and from the heart.
Here we see a 3D model of the blood pool of a heart that has undergone the Glenn procedure. Again, this model shows where the blood flows within the heart rather than the muscle surface. We have colored this model in order to better show the blood flow within the heart. The blue color, here, represents the blood coming back from the body to the heart that has low oxygen levels and is called deoxygenated blood. The red indicates the blood coming back from the lungs and entering the heart that has high oxygen levels and is called oxygenated blood. When the blue deoxygenated blood mixes with the red oxygenated blood, then the blood is partially oxygenated, meaning that it has moderate levels of oxygen and is colored purple. The heart would sit in the chest something like this, as if you were looking at the heart of a person standing in front of you. I'm going to show you the path of the blood flow and point out the important anatomy along the way. This heart represents a patient with hypoplastic left heart syndrome, and this patient has previously undergone a Norwood procedure. Blood enters the heart here, where the inferior vena cava joins the right atrium. This allows the deoxygenated or blue blood from the lower half of the body to reach the heart. In the typical heart, and after the Norwood procedure, the superior vena cava would bring deoxygenated blood from the top half of the body to the right atrium. After the Glenn procedure, the way that the blood flows to the lungs is different. In the Glenn procedure, the superior vena cava is detached from where it would typically join the right atrium. And instead, it is joined to where the pulmonary artery is, right here. This means that all the returning blood from the top half will flow directly to the lungs through the right and left pulmonary arteries. Because the blood can flow directly to the lungs, it does not require a pumping chamber or ventricle to get to the lungs to become filled with oxygen. Once blood has received oxygen from the lungs, it returns to the left side of the heart and the left atrium. This is through the pulmonary veins, seen here as the red blood coming back to the heart. In this heart model, you can see that the left ventricle, over here, is tiny. This is especially tiny compared to the right ventricle. What this means is that the blood cannot leave the left atrium the normal way because it is too small. The oxygenated blood must cross from the left atrium into the right atrium, which we can see this way, over here, where it mixes with the blue deoxygenated blood in the right atrium that came from the lower half of the body via the inferior vena cava. This creates the mix of partially oxygenated blood that we can see here in purple. The mixed blood in the right atrium travels through the tricuspid valve into the right ventricle. The right ventricle serves as the main pumping chamber in this heart with hypoplastic left heart syndrome. The blood flows out of the right ventricle, like this, out to the body through the neo-aorta, which was created in the previous surgery. Because partially oxygenated or purple blood is flowing to the body, children with this procedure will have lower oxygen levels than a typical child. During the last surgery, the Norwood, a conduit or tube was placed in the right ventricle and connected to the pulmonary arteries to provide blood flow to the lungs. In the Glenn surgery, the conduit has now been removed and is no longer needed to send blood to the lungs. Now, the blood gets to the lungs by traveling through the superior vena cava to the pulmonary arteries, which we can see here. Now, blue blood from the upper body returns directly to the lungs to receive oxygen. This is the key change caused by the Glenn procedure, in that it allows the lungs to receive the blue deoxygenated blood from the upper body without traveling into the heart and without needing a pumping chamber. The oxygenated blood can still return to the left atrium, but it cannot exit into the left small ventricle. It is too small. This oxygenated blood from the left atrium crosses over into the right atrium, over this way, where it mixes with the blue deoxygenated blood from the rest of the body. Remember, this blood is returned to the right atrium via the inferior vena cava. The oxygenated blood and deoxygenated blood mix in the right atrium before traveling into the right ventricle, in here, and then out to the body through the neo-aorta. Patients who had a tube that connected the right ventricle and the pulmonary arteries in a previous surgery now have had this tube removed. Because of the partially oxygenated purple blood going to the body from the heart, children with the Glenn circulation will typically have oxygen saturations about 75 to 85%. Typical saturations in children are above 95%, but as we said, lower saturations are expected in someone who has the Glenn procedure. Connecting the superior vena cava to the pulmonary artery here creates a stable source of blood flow to the lungs and allows the final surgery, called the Fontan procedure, to take place around age 2 to 4.
Thank you for watching our video on the second stage of single ventricle surgery, the Glenn. This is a complex procedure, and you may wish to watch the video again or check out our other content at 3dheartproject.com to better understand this or other heart defects. Thanks for joining us.